Hi, this is Dr. Mancini, and I'm so excited today to interview one of the greatest, what I call a living legend in chiropractic, and that's Dr. Mark Charrette. Hey, Mark, how are you today?
I'm great. Thank you for inviting me.
You know, Mark, I've been a big fan of you. As you know, you and I have worked together for over 20 years. When I was running Parker seminars, you always graced us with your presence and giving lectures. I still remember giving you the award. I think it was your thousandth presentation in Australia, of all places, because I know you're giving thousands of presentations when it comes to primarily chiropractic technique, specifically extremity adjusting. And you are known as one of the biomechanic gurus in this profession. You've written a book. I think you graduated in 1980. So I just want to say, first of all, thank you. Thank you for the great contributions that you have given all of us. And thank you for making us better practitioners by your teachings.
Well, thank you very much for that. And by the way, my 1000th presentation was in Melbourne, Australia, and you did present me with the award there. That was great. And believe it or not, I'm at 1,998 seminars. So I'm 2 away from 2,000. And if it wasn't for the COVID stuff, I'd be over that right now. But it's truly been a pleasure over the years, continually learning and teaching and traveling.
Well, let's talk a little bit about your passion, because biomechanics of the lower extremity primarily is your passion. I mean, you teach it with such excitement. Your knowledge is unbelievable. So tell me a little bit about how, as a chiropractor, I need to be more aware about the biomechanics of the body, especially when it comes to our lower extremity.
Yes. Well, probably due to fate, my chiropractic career changed before it started. To make a long story short, I met Dr. Monty Greenawalt, the developer of foot levelers, while I was a student at Palmer in Davenport. He purchased a mansion there, and I was one of the students that helped refurbish it, and later on was kind of his semi-personal assistant. So I may have been one of the first students to ever use orthotics on patients as a student. So it got me interested in the lower extremity initially, and what used to be called sports chiropractic. So I learned how to adjust the feet from many, many different people over the years. But in the 1990s, I spent parts of 4 years in Germany working with biomechanics experts. And what we did is we used a European version of bone and skin markers to track motions in feet, knees, hips, from heel strike to toe off. We actually tracked 53 different motions, of which 7 of them we found were primary in the feet. And that's what I've called my pronation protocol. And that's what I actually teach. And over the years, I've been able to expand and I think improve my teaching in that I now use a type of protocol called deliberate practice. So instead of showing the adjustments, going through them once or twice, we go through them 30 to 36 times: right foot, right knee, left knee, hips, wrist, elbow, shoulders, and then also when I teach TMJ and ribs. So that's kind of where I've progressed now. So I have what's called whole body adjusting. Sorry, I interrupted. A whole body adjusting where I adjust the spine. I also have a spinal pattern that I teach. And then based on indicators and not symptoms, I adjust feet, knees, hips, wrists, elbows, and shoulders. And again, I've adjusted you many times, so you know what I'm talking about.
You know, and you're one of the best adjusters I've seen in our profession. Let's talk a little bit about what are some of the most common biomechanical problems that you see in your practice, but also that so many of your students, thousands and thousands of chiropractors across the world. What are maybe the top three that you would say most chiropractors are seeing in their practice?
Well, I would have to say the thing that has gotten me the most attention is my knee adjustment that I learned from a doctor in Canada. And as a result of that, getting great results on knees that were degenerated, meniscal problems, ACL problems, I decided to look for patterns in the extremities. And so what I teach and what I focus on is what you see most of the time. So in a foot, you're going to see a pronated foot most of the time. So the navicular cuboid cuneiforms, metatarsal heads, talus calcaneus, and fibular head go in a very predictable pattern. When it comes to the wrist, it's the same thing. The mechanism of injury almost every time is extension of the wrist. So we did motion x-rays, right wrist, left wrist, and obviously we found a very similar type of pattern in that when your wrist goes into extension, the lunate, scaphoid, triquetrum, radius, ulna, they all go in very predictable directions. So I have a subluxation pattern for that also. And then so feet, knees, feet, wrists, and then I'd say the next one is shoulders. That was a tough one for me to figure out, but I now have a protocol now since the 90s that involve 5 joints in the shoulder: the glenohumeral, the acromioclavicular, the sternoclavicular, the first rib, and the scapula. And most shoulders, right around 90% of them, have a combination of these 5 subluxation patterns. So I like to do what I call adjust in the pattern, stabilize using things like braces, orthotics, tape, and then rehabilitation, which would be the use of basic exercise and cold laser.
That's awesome. So let's talk a little bit about the superpulse laser therapy, because I know you've been a big fan. I know you added to your protocols. Tell me a little bit about how is it that superpulse laser therapy really fits in a chiropractic practice?
Well, I was one of those very skeptical people when I first saw laser. I'm used to using interferential current. I'm used to using some pulsed ultrasound wave because I'm a 1980s grad. When I first saw it, I was like, I don't know. Well, I had an experience where I was living in just outside of Columbus, Ohio at the time. And as you know, I travel almost every weekend. I was waiting for my bag. I lifted my bag and there was another bag behind me. I tripped and fell. I fractured the radial head on my left elbow. Oh my gosh. Pain, 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 pain. I had a soft cast on it and ended up the next weekend in another city. It was actually Washington, D.C. And there was a person there who had a multi-radiance laser, a portable one. And he said, let me use that on you. And I'm like, yeah, okay, fine. Well, I didn't know anything about high frequencies are for pain and swelling. Low frequencies are more for tissue rejuvenation. Didn't know anything. So he does about 4 minutes right over the radial head, kind of the point and shoot method, as we say. And I got significant relief in about 5 minutes. And I'm like, okay, I'll listen to you. I had 3 treatments over the weekend, 3 4-minute treatments, and I was 95% out of pain. And I've been suffering all week. I've been using ice. That was really about it, using ice and some natural anti-inflammatories, curcumin, things like that. So I was at a seminar and I met the owner of Multi-Radiance, Max, and told him about what had happened. And he said, well, let me send you a laser and just use it for a while. And at the time I was exclusively traveling. Let's fast forward to the future now. 3 years ago, due to some personal experience in my family, due to opioids, I decided after 28 years of being full-time on the road at age 64, and I'm 66 now, that I would go back into private practice. And so I utilized this laser like I can't believe now. Example, April 1st, while walking my dogs, my dogs and I were attacked. Long story short, I was out from April 1st to June 1st due to bites on my knee and my hand. Um, I had an infection in my hand that required surgery. Uh, about 3 days after the surgery, I started using the laser. Exactly how Chris had taught me, and went back for my usual checkups, and the surgeon could not believe how quickly I was healing. And I knew all the research and whatnot. I knew it was going to help me, so I wasn't surprised. I have so many stories from my patients, but I've got to tell you one thing that is beyond amazing. I have a 5-year-old poodle who completely annihilated the ACL, which is called the cranial cruciate ligament, in his left knee. He had what was called a tibial plateau leveling osteotomy, where they changed the angle of the tibia on the femur. And the veterinarian, we've known him for years, and I told him I'm going to use this cold laser. And he said, I wish I could get this clinic to purchase one. Long story short, I used the laser twice a day on a progression where we went from the high frequencies for the pain and inflammation down to the low. At 8 weeks, okay, he's now 15 weeks post-surgical. At 8 weeks, the surgeon rechecked him along with the vet, and the surgeon says, I've never in my career, and this is a woman, a lady surgeon in her 50s, so she's been doing it a long time. She says, never in my career have I ever even remotely seen anything heal this fast. What's going on? And so I told her about the cold laser and gave her some information on that. So I think so that's some personal experiences that when you experience those things yourself. So between my elbow and my hand, and I'll show you right now. I mean, here's my laser. I use it every morning, okay? I've learned to use it on my brain, okay? It has effects on telomeres. I put it over my heart on low frequency 3 times a week. I want to live well over 100 years old. And this is one of those things that different people use it for different things. And I've got the big dual unit at my office that I use on patients. And one of the most difficult things for anyone who's doesn't know much about cold laser, there's no sensation to it. It's not like interferential current. It's not like ultrasound where there's a warm little fuzzy buzz or something. It's not like a hot pack, cold pack. There's nothing that way. So different people respond differently, but it usually takes a series of treatments. The physiology behind it is well documented as far as what it does for ATP production. The production of nitric oxide is a huge anti-inflammatory agent. And as long as you know how to utilize the laser, it's great. And I love the simplicity of the MR system because you don't have to, you just basically have to know the higher frequencies are for more acute swelling pain. The lower frequencies are for the more chronic tissue healing type stuff. And then once you learn about what super pulsing does, it creates a better penetration and a better response actually. So I was reluctant to say the least. And who knows if I would have purchased one until I actually got a result on myself. I don't know. So I'm pretty skeptical, but I'm definitely on board with the MR laser. So pretty much use it on most patients.
You know,
Yeah.
Mark, one of the things as I know you, you're an academician, not just and very scientific. You know, how did you feel knowing as a chiropractor and with your credibility that multi-radiance has so much science behind it? I mean, when I looked at their studies, I was really surprised that they had done so much science backing up what the laser does.
Yes, I read the textbook that Max Konarski recommended initially, and it's pretty heavy duty. It explains in general what all lasers do, and then when you find out how uh, multi-radiance, how they have different features. I mean, they call it multi-radiance because there's red infrared, there's also a laser. The pulse technology is something that is harder for me to explain to people, but it pulses, I believe, 1,000 times a second, which I can't even imagine how that happens. And I know that there's some Russian space technology incorporated into this. And so I'm a results oriented guy. So I like better when I do know the how it works, and try to explain it easily to patients. And so I've learned a lot. I used to use a lot of ice, then laser, and I know now about a year and a half ago, due to the research that MR released, that laser works best alone, and to wait 3-4 hours before or after to use the laser. So I'm actually getting better results without it. And the patients kind of like that too. I say, now wait 3 to 4 hours before you put any ice on this, because I always used to joke with my patients. I said, hey, if I can't fix it, I'll freeze it, and we would all laugh. But anyway, so now my ASR, adjust, stabilize, rehab, the laser is a huge component of it. And I'm glad I have it. There are things that amaze me. Chronic migraine patients. Oh my gosh. I was one of those guys that I don't know how most chiropractors are, but I was hit and miss. I would have my miracle cures and I would have my total failures, and my success rate has gone up significantly since I used the protocol that Chris taught me for the migraines. Yeah.
You know, Mark, one last question, and that is for somebody out there that perhaps has never experienced superpulse laser therapy, for somebody out there that is maybe thinking of incorporating laser into their clinical practice, or maybe even that they have a unit, but they haven't used it that much. They just kind of leave it there, and don't pay much attention to it. What is something that you would want them to know based on your experience?
It really comes down to education. If the doctor knows how it works and why it works, um, then you're more likely to use it. So I would recommend getting on the webinars that Multi-Radiance puts on a regular basis. They have a variety of speakers on a bunch of topics. I think the one coming up next week is for athletic performance. You'll see how you can use certain frequencies to enhance performance. And then also after activity, you can use the laser for recovery. So once you learn those protocols, I would say, yeah, so you've got to educate yourself. I mean, the old point and shoot stuff and everybody gets the same frequency the whole time, it's not going to work well. The unit is very simple to use, and you'll understand how constant frequencies work, how the pulse frequencies work, and that's why I bought a portable one so that I can use it on myself at home. And because I got tired of hauling it back and forth every night. So yeah.
And I love the fact that the portable units are so practical to use and easy to take with you, especially when you and I have been on the road for so many years.
Yes, I travel. I travel with it, and I don't have any problem going through security. I take it out and put it in the little bin, um, so that nobody messes with it. And but no, it's been great. I've had it. I don't know how many years now, 5 or 6 years, and Yeah, I use it. I use it for a variety of things, preventative stuff on my heart and brain, and then for any acute chronic stuff I have. So I enjoy a pretty much pain-free life. I'm not this typical 66-year-old chiropractor who's been in practice or been out 40 years who has all these problems. I went for a big physical 3 weeks ago, and he said, "So, what kind of problems you have?" I said, geez, I think I got a little scuff on my shoe here, and geez, I got stuck at the light on the way here, but other than that, I don't really have any problem. But so my blood work was great, everything's great, and I just see it as good chiropractic care, good nutrition, and the laser. I believe that it's going to do a lot more things for me than I'll ever realize. So I'm on the team. I support it wholeheartedly.
Well, thank you, Mark. And again, thank you so much for all you do for our profession. It's always an honor to see you and to be with you, and also to call you a friend. God bless you, my friend. Thank you.